Medical management. Non-steroidal anti-inflammatory drug or NSAIDs ease fever, inflammation, headaches, and muscle aches. These drugs include ibuprofen, Advil, and naproxen aleve. Acetaminophen Tylenol also works. Corticosteroids. Swollen tonsils may result to difficulty of breathing in some patients. Therefore, corticosteroids may be prescribed. Antibiotics. Treatment includes symptoms control such as the treatment of strep throat with antibiotics. Antiviral drugs may sometimes be used by physicians, but they may not be useful in most cases of mono-EBV infections. Surgical management. Splenectomy is surgery to remove the entire spleen. This surgery is necessary for spontaneous splenic rupture which occurs in rare patients with EBV infectious mononucleosis and may be the initial manifestation of the condition. Nursing diagnosis and nursing management. Nursing diagnosis. Infection related to Epstein-Barr virus mononucleosis as evidenced by positive EBV blood smear result, temperature of 38.5 degrees Celsius, sore throat, and increased white blood cell count. Nursing management. Assess vital signs and monitor the signs of infections to establish baseline data. Administer the prescribed antibiotic for strep throat and corticosteroids as prescribed. Antibiotics are only used to treat strep throat. They do not treat a viral infection, like EBV. Teach the patient to avoid direct social contact as much as possible and to perform proper hand hygiene in order to reduce the risk of spreading the EBV infection. Obtain a new blood sample for EBV smear to confirm the infection is completely treated. Nursing diagnosis. Hyperthermia related to mono-EBV infection as evidenced by temperature of 38.5 degrees Celsius, rapid and shallow breathing, flushed skin, profuse sweating, and weak pulse. Nursing management. Assess the patient's vital signs at least every hour. Increase the interval between vital signs taking as the patient's vital signs become stable in order to assess in creating an accurate diagnosis and monitor effectiveness of medical treatment. Administer the prescribed antibiotic and antiviretic drug medications. Remove excessive clothing, blankets, and linens. Adjust the room temperature in order to regulate the temperature of the environment and to make it more comfortable for the patient. Offer a tepid sponge bath in order to facilitate the body in cooling down and to provide comfort. Elevate the head of the bed in order to promote lung expansion. Nursing diagnosis. Fatigue related to anemia secondary to mono-EBV infection as evidenced by overwhelming lack of energy, verbalization of tiredness, generalized weakness, lack of appetite, and shortness of breath upon exertion. Nursing management. Assess the patient's degree of fatigability by asking to rate his or her fatigue level. Explore activities of daily living as well as actual and perceived limitations to physical activity in order to create baseline of activity levels, degree of fatigability, and mental status related to fatigue and activity intolerance. Encourage progressive activity through self-care and exercise as tolerated in order to gradually increase the patient's tolerance to physical activity. Teach deep breathing exercises and relaxation techniques in order to allow patient to relax while at rest and to allow enough oxygenation in the room. Prognosis. The long-term prognosis for most people with mono is excellent and severe complications are rare. Most people with mono recover completely with no long-term problems. References.